Today, all of us stand before you and proudly proclaim our belief that health care in America must be a right, not a privilege. Today, we begin the long and difficult struggle to end the international disgrace of the United States, our great nation, being the only major country on earth not to guarantee health care to all of our people. As proud Americans, our job is to lead the world on health care, not to be woefully behind every other major country. Today, we begin the debate vital to the future of our economy as to why it is that in the United States, we spend almost twice as much per capita on health care as any other nation on earth, and yet we have 28 million people without any health insurance and even more who are underinsured with high deductibles and co-payments. As a result of the incredible waste, bureaucracy, and profiteering in our dysfunctional healthcare system, we are now spending nearly 18% of our GDP on healthcare, $10,000 per person. Incredibly, if we continue the status quo, we will spend an estimated $49 trillion over the next decade on healthcare. That is economically unsustainable for our country. Today, we say the function of a rational healthcare system is to provide quality care to all in a cost-effective way, and not to continue a system which allows insurance companies and drug companies to make hundreds of billions of dollars in profits each year, and to make healthcare industry CEOs extremely wealthy. Further, as you've heard this afternoon, the function of a good healthcare system is to enable people to get the healthcare when they need that healthcare, not to deal with an endless amount of paperwork and to spend hour after hour arguing with insurance companies about whether or not you have the coverage for the procedures that you need. The strengths of a Medicare for All program are not only its universality and its cost effectiveness, it also ends the complexity of a system which adds enormous stress at a time when people need it the least. And today we say to those families in Vermont and in Wisconsin and California and all across this country who are spending $10,000, $15,000, $20,000 a year on health insurance, that we understand that this is insane and unaffordable to be spending that much money simply to protect the well-being of your family. And we're here to tell those families and people all across this country that under Medicare for All, the average American family will be much better off financially than under the current system, because you will no longer be writing checks to private insurance companies. While, depending on your income, your taxes may go up to pay for this publicly funded program, that expense will be more than offset by the money you are saving by the elimination of private insurance costs. And today, we tell the drug companies that the American people are sick and tired of the greed of the pharmaceutical industry. We are no longer going to get ripped off and pay the highest prices in the world for prescription drugs under Medicare for All. We're going to negotiate lower drug prices for the government and for every single American. And today we tell the business community, especially small and medium-sized businesses, that we understand that you want to focus on your core business mission, not to spend countless hours worrying about how you will provide health insurance to your workers. And Medicare for All will allow you to do that because all of your employees, by right, will have comprehensive health care. And today we say to millions of workers that you should not have to be stuck in a job that you don't want just because it provides decent health care to your family. With health care as a right, you will finally have the freedom to do the work you love and are passionate about, and our economy and our nation will benefit from that. 52 years ago, President Lyndon Johnson signed historic legislation that said in the United States of America, if you are 65 or older, you will be guaranteed health care as a right. And that legislation, called Medicare, has been enormously successful. We take it for granted now, but seniors in America are healthier, happier, and more secure than before the passage of Medicare. And today we tell our seniors that as good as Medicare is, we have heard your concerns, and for the first time, we will expand coverage to include dental care, hearing aids, and vision needs. Now let us be honest. The crisis we are discussing today is not really about health care. Crisis we are discussing today is a political crisis which speaks to the incredible power of the insurance companies, the drug companies, and all those who make billions of dollars off of the current system. Over the years, these entities have done everything that they possibly can to prevent us from having lower-priced prescription drugs and universal health care. As one example, hear this. Since 1998, the pharmaceutical industry alone has spent over $3.6 billion in lobbying and hundreds of millions of dollars more in campaign contributions. And they charge us the highest prices in the world for prescription drugs. Now, I fully recognize that legislation which deals with 1/6 of our economy and over $3 trillion is complex, and that nobody, including those of us who are up here now, have all the answers. Unlike the Republican leadership, which tried to pass massive and destructive health care legislation without one public hearing, our job now is to take this legislation to every state in the country and to hear what the people have to say. Unlike the Republican leadership, we want to hear from doctors and hospitals and patient advocates and ordinary citizens as to how we can make this bill even stronger and more effective. We want to hear from the American people as to the fairest ways that we can fund this program. But to my Republican colleagues, please don't lecture us on health care. In the last few months, you, the Republican Party, have shown the American people what you stand for when you voted for legislation that would throw up to 32 million Americans off of the health insurance they have, and at the same time give huge tax breaks to the rich and large corporations. You, the Republican Party, have no credibility on the issue of health care. Let me conclude by telling you that I am extremely proud that we now have the support here in the Senate of 16 senators plus myself and a whole lot of folks in the House of Representatives. And importantly, we also have the strong support of dozens and dozens of grassroots organizations and trade unions representing the working people of this country. They know, as we know, that this struggle will ultimately not be won here on Capitol Hill, but through the grassroots activism of millions of Americans who are standing up and fighting back, who are becoming more engaged politically. And when we all stand together, we're going to be able to take on the insurance companies and the drug companies and Wall Street and everybody else, and to do what we should have done decades ago, and finally guarantee health care to all Americans as a right. Thank you very much. Senator Elizabeth Warren, Massachusetts.
Thank you. It is wonderful to be here with you today, but we have to remember, the only reason we are here is because millions of people across this country made their voices heard. They believe that health care is a basic human right worth fighting for, and that's why we're here today. So thank you all. You know, back before I had this job, I had another job where I used to do a lot of work about just trying to understand what was happening to working families across this country and why so many people were going broke. And one of the principal studies that I did along with my co-authors was to introduce an idea called medical bankruptcy. The fact that hundreds of thousands of hard-working people across this country were filing for bankruptcy in the aftermath of a serious medical problem. And here was the real shocker in our data. 3 out of 4 of them had health insurance at the onset of the illness or accident that led to their bankruptcies. That's wrong. And today, it is an enormous honor to stand with each of you to say never again in America does anyone go bankrupt just because they got sick. Never. This has been a long fight from Franklin Roosevelt, who wanted health care for all as part of Social Security, to Lyndon Johnson, who gave us both Medicare and Medicaid, to Ted Kennedy, who made sure that our children were insured with CHIP, and to Barack Obama, who helped build the game changer that gave millions of Americans who didn't have health care coverage new health care coverage. We are here today to take another step. We will not back down in our protection of the Affordable Care Act. We will defend it at every turn. But we will go further. We will go further, and we will say that in this country, everyone gets a right to basic health care. That's what Medicare for All is all about, and that's why we're here. So that's our argument. Everyone gets covered, no one goes broke, and families in some of the toughest moments in their lives will not be left alone. I want to say thank you to Bernie for all that you have done. I am honored to be part of this fight. I am honored to have a chance to stand up and say one more time, health care is a basic human right, and we fight for basic human rights. Thank you all. Thank you. Thank you. Thank you, Bob.
Is Brian Schatz? Yeah. Brian Schatz here? Oh, Brian left. Okay. Brian Schatz of Hawaii had to leave. The other senator from Hawaii is here. All right. And we're going to get to that senator in a second, but let's bring up Kamala Harris of California.
Thank you, Bernie. Well, I'm honored to stand with my colleagues and be in a room full of leaders. And this is a moment in time that I think we know is a very significant moment in time for our country, where we, all of us, are standing up and saying, let's just do what's right. You've heard so many folks talk about it because we know it. Listen, no baby is born in America born as a Democrat or a Republican. This should not be thought of as a partisan issue. It's not even a bipartisan issue. This is a nonpartisan issue. Cancer, diabetes, high blood pressure affects folks around our country regardless of whether they're in a red state or a blue state, regardless of their income, regardless of their status. And we should not differentiate in the way that we do public health policy. We should understand everyone, all, should receive the health care they need regardless of where they live, their income, or their zip code. And that's what this bill is about, and I am proud to co-sponsor it. It is about saying that this is about a right, not about a privilege for a few. And let's be clear, it is not only about what is the right thing to do morally and ethically. It's also smart in terms of the fiscal impact. Taxpayers will benefit. You know, our friends in the private sector, they talk about all the time. If they're asking about, are they being efficient, are they being effective? They ask that question with 3 letters. What is the ROI, return on the investment? Well, the taxpayers of the United States deserve a better return on their investment. Yes. And when you look at this situation, what we know, the public health model tells us so well. You want to deal with an epidemic? Smartest, most effective, and cheapest way to deal with it is prevention first. If we're dealing with it in terms of early intervention, and certainly if we're dealing with it in the emergency room, it's too late and it's too expensive. Let's give the taxpayers of the United States a better return on their investment, which means Medicare for all. And why? Because Medicare for all stands for the proposition that all Americans from the day of birth throughout their lives will have access to health care. It means understanding that the data tells us somebody with high blood pressure, if they are receiving consistent care, information about what they should be eating, testing and monitoring their blood pressure, we know if we reduce that population who have high blood pressure by just 5%, taxpayers will benefit by $25 billion over the next 5 years. Better return on the investment. Let's look at it in terms of the emergency room. If people resort to the only care they can get in an emergency room, as opposed to monitoring on a daily basis, on a regular basis with a physician that they know and trust, we're looking at right now in the United States, $35.7 billion a year in unpaid emergency room bills. It's a better return on the investment for the American taxpayer, and that is why I'm proud to stand with my colleagues and friends and support Medicare for all. Thank you.
Thank you. Is Cory here? Senator Cory Booker of New Jersey.
New York and New York rocking. New York always in my way.
Let New Jersey through.
Thank you very much for giving some Jersey love. I am so proud to stand here today with my colleagues, with nurses, with doctors, with activists who understand the truth of our country. We were founded with incredible ideals, but we were far short from a reality that reflected the spirit of this nation. And every generation of our country has worked to expand access to our foundational ideals, that every American should have life and liberty, that we should have equal justice under the law, literally that we fulfill our pledge that we are a nation with liberty and justice for all. And so we fought, and people died to expand access, universal access to the ballot. We fought, and people died to expand universal access to civil rights. We fought, and we struggled to make sure every child had universal access to public education. But when it comes to one of the most basic aspects of the ideals of life and liberty, you must include that every American has access to quality, affordable health care. And so this is the fight for our nation to live up to our ideals. Because you cannot have justice in this country where you have millions of Americans who cannot get access to basic health care because of the amount of money they make. You cannot have liberty when millions of American families are shackled and chained to fear and illness and sickness because they can't afford the medication or can't afford to go see a doctor. You cannot have a nation that professes to favor freedom if so many families feel the pain and the constriction of having to worry about affording their rent or being able to meet their basic needs of their family or pay to go to the doctor. And so now more than ever, we have to understand that this is a defining moment of the character of our country. How can we, the greatest nation on the planet Earth, have the most expensive healthcare system, fast approaching 20% of our GDP, but not get healthcare outcomes anywhere near our competitor nations? It is embarrassing to me. I love my northern neighbor, but it is embarrassing to me to have a Canadian stand here in the capital of the United States of America and talk about a system that takes care of their children better than we take care of our children, our most valuable natural resource. And we are leaving so many of our children in the insecurity, in the pain, and the agony of not having access to quality health care. And so I was getting a little competitive back here with some of the New Yorkers and the Californians. And so let me just end with the words of one of the patron saints of New Jersey, a man named Bruce Springsteen. He says it proudly. We are a nation that takes care of its own. I cannot sit when Australia or Canada or England takes care of every one of their children better than the United States of America. In this nation, this noble country, this country of love and compassion and empathy, we must stand up right now and say that we will be the symbol of hope and light and freedom and justice and liberty for all. Thank you.
I want to thank all of our guests who traveled here today to talk about the need for Medicare for all, and all of my colleagues here in the Senate and our friends over in the House, and mostly the American people. And here is the simple truth. Our opponents on this issue have the money and they have the power. But if millions of people across this country stand up, get involved in the political process, and fight back, I have no doubt, none whatsoever, that this nation, sooner than people believe, will in fact pass a Medicare for all, single-payer system, and finally, health care will be a right for all in the United States of America. Thank you all very much.